Hey, this is Dr. Ty from Premier Orthodontics, and in today's video we're going to be going over a before and after case of a patient. This patient was an adult patient who was missing a tooth, so we did what's called canine substitution. So we're going to show you how that works, how we treated her case. So if you haven't yet, make sure to like and subscribe to the video. And if you live in the Phoenix, Arizona area, we do free consultations. Check out the link in the description for more information. All right, so let's jump in here for this patient. So we did some arrows. You can see kind of where her major issues are. On this top area here on the screen on the upper left, you can see she's missing her second tooth or her lateral incisor. So this is the central, this is the canine. Normally you'd have this tooth. So she was just missing this tooth from birth. That happens sometimes. And so because she was missing this tooth, all of her teeth on the top have shifted to the right. You can see her midline here. The lower midline is onto her face. The upper midline has shifted to the right about half a tooth. And then you can see her bite, it doesn't fit together quite right. She has what's called a cross bite where the top teeth are too narrow relative to the lower arch. And then she has some crowding as well. So she came in, she wanted to get her bite fixed. Her main concern was that she was worried she's going to wear her teeth down due to her bite being kind of edge to edge. And so she said cosmetically she wasn't too concerned, but she just wanted to make sure she had a healthy functional bite. We told her we could definitely fix that, but let's try to make it as cosmetic as possible as well. Her treatment to fix all of her problems are going to include some cross elastics for the crossbite. We'll show you how that looks. We're going to do what's called canine substitution, where we're going to use that canine and substitute it for the tooth that's missing. And we'll show you how that works. We also did some interproximal reduction, or IPR, in the lower arch. We'll discuss that as well. All right, so here you can see her top teeth are inside of the bottom. We want to push these outside and get them to come outside the bottom. So we use what's called cross elastics. In cases that aren't severely constricted, we'll use this quite a bit, and we'll play this animation. You can see how it works. So again, the top teeth are inside of the bottom ones. We want the top teeth outside. So the rubber band gets hooked up from the tongue side of the upper tooth, and it goes to the cheek side of the lower tooth. And you wear these 24/7, take them out to eat under brush, and over time, they will bring those top teeth out and bring the bottom ones in. Kind of get that correction. So she wore cross elastics for quite a while during the early start of her treatment. So that's how we fixed her crossbite in the back. All right, so canine substitution. You can see this canine tooth is this big pointy tooth. We want to make it look like this tooth that's over here. So she's missing this tooth, and we want to make this tooth resemble this one. So this animation will show how that works. It's a little bit longer animation, so I'm going to skip ahead. So you can see if you had space, you would put in this elastic chain called a power chain. You also use a rubber band to help shift the bite forward. So you're bringing that canine all the way forward. In this patient's case, the canine was already forward, so we didn't have to do that as much. But then we'll substitute that canine where we will reshape and polish that canine to make it resemble the tooth that's missing. So we basically will use our handpiece, and we remove the cusped tip of that tooth, and we reshape it as well as we can to make it look like this tooth over here. So that's called canine substitution, where we're trying to bring all these teeth forward. And so we use that same rubber band that showed in the video that went from here to here to pull all the top teeth forward to try to bring this midline over. And while we were doing that, we reshaped that canine to make it look like this one over here. And for this patient, you can see she's got a lot of crowding on the bottom, and we needed to reduce the size of the teeth down here because she's missing an entire tooth up top. In order for the teeth to fit together properly, we need to reduce the size of some of the teeth on the bottom to make up for that discrepancy, because she's missing a whole tooth up top, which is about 7.5 millimeters. We needed to take off some amount of tooth structure on the bottom as well. So we do that by a method called interproximal reduction, where we take either this little disc or a strip sometimes, and we'll just go between the teeth and take off about 0.5 millimeter tooth structure in between each contact point. So it's just this tiny little space. But all that little bit of space adds up. As we make that space, we can pull those teeth back. And you can see the goal is we want to tuck these canines and these lower front teeth underneath the top ones. So by using the IPR, the interproximal reduction, we can pull those teeth back and help them to fit under the top teeth. So we did IPR on her lower teeth quite a bit in order to help get them to fit. And we also did the rubber band to help pull the top teeth forward as well. All right, so reviewing again, this is our patient when we started. You can see her upper midline is to the right. We did that rubber band to help try to pull all the top teeth more to the center. We did IPR on the bottom to help tuck those teeth under the top ones. Then we did the crossbite elastic to try to bring the top teeth out, and widen out that upper arch while at the same time constricting the lower arch just a little bit. And then while we were at it, we were going to reshape this canine tooth and substitute it for the missing one. So we're going to use this tooth and reshape it to look like the one that was lost or that was missing. All right, so this is the patient when we were all done. You can see this is her canine tooth. It has been reshaped. You can see it looks more like the one that is missing. It is wider, and so that's something that we were okay with. You have to make some compromises. You can see her midline has improved quite a bit. It still is off by about a 0.5 millimeter. And sometimes, like I said, it's getting it as close as we can. We got 98% of the way corrected. This looks much better. Sometimes perfection's not attainable, but we do the best we can. And then we were able to get all the lower teeth tucked under the top ones by doing the IPR. We reduced the size of these teeth on the bottom, and then we were able to fix the crossbite as well using the crossbite elastics. So we'll look at some before and afters here. So you can see how much of the midline correction we got, where the upper midline was way to the right, and you can see facially we were able to bring it much more onto the face as well. You can see the reshaping of that canine makes it look much more natural, and then just this bite here where before it was kind of cusp to cusp. That was the patient's main concern, was, is this going to wear down my teeth over time? You can see now the teeth fit more like gears, where they fit into the cusp and the fossa is what we call it, and that's the relationship that we want to see. You can see aesthetically it looks much better. By the time we were done, the patient was definitely more interested in aesthetics, and she loved the way her smile looked, and it was, she was happy with her appearance as well as the health of the teeth. All right, so that is the case. So if you have any questions about this case, about canine substitution, or about any other topics we discussed, you can ask them in the comments section below. We'll do our best to answer. If you haven't yet, make sure to like and subscribe to the channel. And if you live in the Phoenix, Arizona area, we do offer free consultations for braces or Invisalign. You can check out the link in the description or visit our website at yourazbraces.com. Thank you so much for watching. We'll talk to you soon.